Welcome, freedom fighters. JP Campbell, 7-4 here. Wanted to take an opportunity to kind of dissect this press conference that Governor Greg Abbott gave yesterday. Let's go through it together. As I watched it live, what I took away from it was a lot of double talk, and a lot of half promises and things like that. So let's dissect it together and see if we can kind of distill down what he's really saying here.
Listen, for the past 2 months, Texans have forged a bond of unity and trust. We've worked together for a cause far greater than ourselves. Millions of Texans have sacrificed their livelihoods as well as so many of their cherished moments.
So my definition of sacrifice is something that you do willingly. Our livelihoods have been stripped away from us by force. Also, I'd like to add that I recognize a lot of you folks are probably diehard Republicans, and I get that, so it's not my goal to bash Governor Abbott here, but I would like to encourage you to at least consider the possibility that both the Democrats and the Republicans are two wings of the same corrupt bird.
In an unprecedented effort to prioritize the health and safety of our fellow Texans, there's been a collective effort to slow the spread of COVID-19. Well, because of your efforts, the COVID-19 infection rate has been on the decline over the past 17 days. Because of your efforts, and especially the work of our doctors and nurses and all healthcare providers, our hospitalization rate has held steady, and our hospital capacity has remained abundant. At the same time, we must not forget those who have lost their lives because of COVID-19. Our hearts will remain with their families and their loved ones.
Do you know anyone who lost their lives from the Rona, who didn't already have an underlying health condition? I don't.
Every life lost is a tragedy. The fact is, the tragedies in Texas have been far fewer than in most states in the United States. And I'm proud to say that Texas has the third most recoveries from COVID-19 in America. In fact, the number of people who have recovered from COVID-19 will soon exceed the number of active cases. The lives saved are priceless, but the price has been steep. Many have lost jobs. Others have lost businesses. Many are struggling to pay their bills. I want those Texans to know they are not alone in this fight. Just as we united as one state to slow COVID-19, we must also come together to begin rebuilding the lives and the livelihoods of our fellow Texans. Well, since March, we've been laying the groundwork to reopen Texas. We ensured additional hospital facilities were available to meet the needs of COVID-19 patients.
Right, like the multi-million-dollar pop-up hospital that did not see a single patient that we'll be paying for decades.
We stocked up on PPE supplies like masks. We closed schools to slow the coronavirus spread. We even required travelers from other states to self-quarantine to reduce importing COVID-19 into Texas. And we also reduced large gatherings of people to better slow the spread of the coronavirus.
Also known as medical martial law.
Also, I deployed more than 3,000 Texas National Guard. They will be operating 25 mobile COVID testing sites across Texas.
Is that all they're going to be doing?
As well as 3 fixed testing sites in Houston, Huntsville, and Kingsville. They are operating 9 PPE distribution sites, and they deployed a team that manufactures more than 500,000 N95 masks each day. They've already made more than 6 million of those masks. And they're also helping Texas families. They've deployed almost 1,000 National Guard to prepare and serve meals at food banks across our state.
Is that an additional 1,000 to the previous 3, or a segment of the original 3? Does that make 4,000 total?
Now, we also are working for those who are filing unemployment claims. We have provided the Texas Workforce Commission with desperately needed help to respond to the record-breaking unemployment claims that have been filed, with new hires, as well as volunteers that have been offered up by both the Texas House and the Texas Senate, as well as from state agencies. We have more than tripled the Texas Workforce Commission staff to more than 2,000. More than 1.9 million claims have been filed. But now, more than 1.6 million have been processed. And over $2 billion has been paid out in unemployment benefits. Now, our goal, of course, is to get those Texans back to work. And that is what today is all about. My executive order to stay at home that was issued last month is set to expire on April the 30th. That executive order has done its job to slow the growth of COVID-19, and I will let it expire as scheduled. Now, it's time to set a new course, a course that responsibly opens up business in Texas. We will open in a way that uses safe standards for businesses, for their employees, as well as for their customers. Standards based upon data and on doctors. I want to thank the Strike Force team led by James Huffines, working with a board of advisors and consulting with doctors to hone best practices that allow as many businesses as possible to open in ways that contain the spread of COVID-19. I also want to thank the Lieutenant Governor, the Speaker, as well as all of our legislators.
Lieutenant Governor needs to be running the show. I'm sure a lot of you folks agree with that.
And I especially want to thank our team of medical professionals who have spent countless hours providing input about the safest ways that businesses can operate. The team includes Dr. Hellerstedt, the Commissioner of the Department of State Health Services. It includes...
All right, so this is just a bunch of filler here, so let's move forward a little bit.
In fact, it's hard to get rid of this virus because it is so contagious.
So contagious. So contagious. I've not changed my way of life, nor has my family, not one bit. Not even a little bit. Again, I'm not saying it's not real, but is it so contagious? I mean, you're going to have a hard time convincing me of that.
So we're not just going to open up and hope for the best.
Oh, we're not just going to let you go back to your life and earn your money. We're going to keep you suppressed. We're going to keep the thumb of tyranny pressing you down.
Instead, we will put measures in place that will help businesses open while also containing the virus and keeping Texans safe. Now, I said 10 days ago, opening Texas must occur in phases. Obviously, not all businesses can open all at once. A more strategic approach is required to ensure that we don't reopen only to have to close down again.
Did you catch that? And you'll notice that as a theme as we go throughout. The dangling of the threat of, we're going to let you open a little bit, but if you step out of line, we're gonna dial it back. I want you to kind of keep that in the back of your mind as we go forward. You'll hear it 3 or 4 times. The dangling of the threat, if then but, right? If we open, but then it ticks up, we're going to have to pull you back. It's a veiled threat. Keep an eye out for that.
So consistent with CDC guidelines and based on advice from infectious disease specialists, we will open Texas businesses in phases. Phase 1 begins this Friday, May 1st. If we can contain the spread of COVID-19 during that time period, we can move to phase 2 as
capital IF, if.
As early as May the 18th. Phase 2 will open more businesses and allow the businesses open in phase 1 to expand their operations. We need to see 2 weeks of data to confirm no flare-up of COVID-19. That is exactly why. Now, more than ever, Texans must continue safe distancing practices. If we do that, we will be able to expand into phase 2, opening up our economy even more.
If we do that.
Well, as we go into phase 1, the most important element of phase 1 is protecting our most vulnerable Texans. People age 65 and over represent just over 20% of the Texans who test positive for COVID-19. But more than 75% of deaths were people 65 and older. Here's the point. If we redouble our efforts to protect our most vulnerable senior citizens, we can reduce COVID-19 deaths while also expanding business operations and increasing the number of Texans re-entering the workforce. To achieve these goals, Phase 1 does several things. It emphasizes the importance of vulnerable populations remaining at home if at all possible. If they need to get out, businesses should make special accommodations to limit the exposure that our vulnerable population has.
We get it. I mean, that's pretty standard, right? Older folks are at more risk for any type of illness or disease. Let's move forward a little bit.
All retail stores, restaurants, movie theaters, and malls can reopen May the 1st. Now, to minimize the spread of COVID-19 during phase 1, on the advice of doctors, I am limiting occupancy to no more than 25%.
So you can open, but you can't be profitable.
This is a proven business strategy. It's exactly the type of practice successfully used by H-E-B and Home Depot.
Is this guy serious?
The extent to which this order opens up businesses in Texas supersedes all local orders. If phase 1 works while containing COVID-19, phase 2 will expand that occupancy to 50%.
You only get to go to half broke.
Further increases will be allowed in the future.
So if you follow all of our rules, we'll let you progress to being 50% bankrupt. You start at 25%, or actually it would be 75% bankrupt. And then if you're good, boys and girls, we'll let you go to 50% poverty. I mean, what is really happening?
So long as COVID-19 remains contained. Something important to remember. This order allows these businesses to reopen. It does not require them to do so. If a business owner feels unsafe opening at this time, or for other reasons doesn't want to reopen, there's no requirement to do so.
What idiot would not open their business?
Additionally, all museums and libraries can open under the same 25% capacity. However, interactive areas of museums with hands-on exhibits must remain closed at this time. And again, this is permission to open, not a requirement. Some libraries and museums are operated privately or by local governments or universities.
Has the governor been wearing a face mask? I fear that he may have brain damage. No kidding.
It's up to them to decide if they are able to open. The state will work to open its libraries and museums by May 1 or soon thereafter. Now, a lot of business in Texas is done by sole proprietors. They can safely return to work now. The guidance in this book and online provides safe standards for sole practitioners. Also, churches and places of worship, they were kept open under the existing executive order. But effective May the 1st, they will be able to expand their capacity even more. We do, however, emphasize the importance of safe distancing practices to ensure that church members remain protected from COVID-19.
Now, hear this. Church members are protected by a much higher power than social distancing. I promise you, I've attended my last reduced church service, my last online service. My brothers and sisters, feel free to come on up and give me a hug. Mr. Abbott, you could take to the bank. Forget about that.
Outdoor sports are also allowed at this time, so long, however, as it involves no more than 4 participants playing together at any one particular time.
Listen to all these
and
rules.
So long as certain distancing
Allowed
practices
permission,
are followed.
25%.
Examples of this would be things like golf and tennis. If COVID-19 can be contained in phase 1, the goal would be to expand the number of participants in phase 2 to allow even more sporting activities to be engaged in.
You will never get your freedoms back under this plan. Never.
Doctors, nurses, and dentists, they need to get back to work. But even more importantly, patients need to get in to see those doctors, nurses, and dentists. So, all licensed healthcare professionals are allowed to return to work with few restrictions. However, all licensed hospitals still must reserve 15% of capacity for COVID-19 patients.
Who can follow all of these rules and edicts?
All of these things I've outlined are in addition to the many parts of our economy that never shut down. Our farmers and ranchers, grocery stores and drugstores and hardware stores, our home builders and realtors, manufacturers, construction workers, car dealers, banks, and gas stations all have continued to operate.
Right, so the state and the federal government decides who can survive and who can't, which industries can thrive and which ones can't.
Those and other essential services will be allowed to continue to operate as they have. Now, one thing we all know, Texas is a big state with a very diverse geography. The fact is, not all counties are alike, and not all counties are affected the same by COVID-19. As our medical team explained, even in low population counties, COVID-19 can still spread very rapidly. Moore County and Donnelly County.
Filler talk. That's all this is. Fluff. Let's move forward a little bit.
Now, a core part of opening up safely is having an effective testing and tracing process.
Here we go. Listen carefully from this point forward.
A process that can quickly identify any flare-ups in COVID-19. We have already developed a robust testing and tracing program to help identify others who may have been infected. Phase 1 of our tracing program is already completed. It mobilized a team of more than 1,100 state and local contact tracers. It created a contact tracing IT application. It set up a COVID-19 contact tracing call center. Phase 2 of that program begins today. During the next 2 weeks, they will add another 1,000 tracers. They will deploy the contact tracing application statewide and deploy statewide the COVID-19 contact tracing call center. Phase 3 of the program will use the month of May to build a team of 4,000 contact tracers. Here's what the team does. They test
Nope.
for those who may be affected.
I will not comply.
They then help isolate those who test positive.
Medical martial law.
Then they try to locate everyone who's been in contact with the infected person.
How are they going to do that?
And then they work with them to self-isolate for 14 days. What that process does is it will box in the expansion of COVID-19.
No, it will box in you, the citizen.
This process will be bolstered by an increase in testing. When you aggregate all of the tests run by the state and local governments with the rapidly increasing number of tests run by the private sector, we should easily exceed our goal of 25,000 tests per day. Well, I had the opportunity to talk to Dr. Burks about this plan, and I sent her a copy of it. And she said the Texas plan was great. I want to join governors from across the country.
Check out my man in the background here. He knows this is horse hockey.
From both parties in thanking President Trump for all they have done to help our state. They truly have been available to us on a 24/7 basis. Now, safely opening Texas for business requires 4 things. 1, a commitment to continue safe distancing practices that reduce the spread of COVID-19.
You better believe this social distancing is going to be perpetual. Gone are the days of walking up and giving someone a high five or a hug or a handshake or whatever. That's over with. So just forget about it.
2, reliance on doctors and data to provide the safest strategies. 3, a focus on protecting the most vulnerable from exposure to COVID-19. And 4, a reminder that it is entrepreneurs who drive the Texas economy. They need to be unleashed to restore livelihoods while all of us remain focused on protecting the...
Unleashed. That's an interesting choice of words. We are on a leash. You got that right, Governor.
lives of our fellow Texans. We are Texans. We got this. Next, I turn to James Unveils.
Thank you, Governor. Well, over the past few months, our state has faced unprecedented challenges.
Blah, blah, blah.
Things about Texas. Thank you. Next, Lieutenant Governor Dan Patrick.
Let's see what else he has to say about it.
Thank you, Governor. This has been an incredible team effort, and the most important members of the team are you, because you have followed the guidelines through the various executive orders and the recommendations. We are in this position, quite frankly, better than any other state in the country, and I really believe any other place in the world.
And why we still in lockdown?
So now it is incumbent upon you, as has been said, to continue to social distance, wear a mask.
Nope.
Wear a mask, that's
Nope.
a suggestion, we're not mandating it. Wear a mask.
It can be a suggestion.
Very
We're not doing it.
And it's important to our businesses as they open up for them to have customers.
No
And to our businesses
No kidding.
that today, or starting on May 1, are going to be able to open up. Finally, I know you've been waiting to do that. Customers are going to come to businesses that they see are safe for them. So this will be a team effort between the customer and between the business. Support your local business as a business. Make it safe for your customers. Because the faster we can get to the next step, the more employees you can hire, the more customers will be there, the more business will be created, and the closer we get to something that will remind us of the Texas we were before all of this happened. So
The closer we can get to the Texas that we were. So you notice he didn't say get back to the Texas we were, because we're never going back there. Those days are over, unless we do something about it. We can talk offline about that. But you'll note there'll be very little talk about any hope of ever getting back to how things were. You're being conditioned, you're being programmed, you're being brainwashed to accept this social distancing and the having the loom of danger dangled over your head perpetually.
Thank you, and God bless you. And again, the most important part of this team moving forward is you, the people of Texas. Thank you.
Next, Speaker Dennis Bond.
Thank you, Governor Abbott. Today is a big day for Texas.
So we remain intact.
So this is just a bunch of fluff, a bunch of nonsense. So we're going to move forward to the last part of what the governor has to say.
Can you elaborate? I mean,
without that medical advice, we believe that these are the safe strategies, candidly proven strategies. Here's an easy example. We want to open up stores to 25% capacity. That's the way that stores like HEB and other hardware stores have been operating under for the past month. While we have been able to reduce the spread.
HEB, I love them, don't get me wrong, but they're also a multi-billion-dollar company. And 25% for them is a lot different than 25% for a local mom and pop or a local restaurant owner. Most of us can't survive at 25% of our revenue.
Of the coronavirus. I believe we can re-engage our economy while still containing the coronavirus using these proven strategies.
Governor, you said that we need 2 weeks of data to confirm no flare-ups of COVID-19. Can you elaborate? I mean, specifically, are there thresholds that will make you reconsider the timeline or putting the restrictions back in place?
So, Phase 1 opens up on May the 1st. We want to usher in Phase 2 as quickly as possible, most likely around the May 18th timetable. If there is no flare-up of COVID-19, and let me explain what that means. We will be tracking data. Because there will be an increase in the amount of testing, it's only logical to see there be an increase in the number of people who test positive. So just because there may be an increase in the number of people who test positive, that alone is not a decisive criteria. The things that we look at that are more important is, what does our hospitalization rate look like? Is it remaining flat like it has been, or is our hospitalization rate rising? What about deaths? We've seen a slow decrease on average in the number of deaths for the past few weeks. Does that trend continue, or does it spike up? Are there certain hot spots in certain areas, like what I pointed out in certain regions, for example, of the Panhandle, that need to be contained? So there's no one single factor we look at. We look at all of the data and consider what the data means, and then we consult with our medical team about what that data means, and through that we make a decision about whether or not we are able to go into Phase 2.
Governor, one of the 4 key components or key factors that you mentioned was entrepreneurs drive the Texas economy. And there are some people who invest their money in things like barbershops, nail salons, gyms, and bars that are not allowed to open yet. I think they would argue that there are ways that they could potentially social distance people who come into those businesses as well. What would you like to tell them when they can't open their doors but other businesses can?
We want hair salons,
Look at the smirk. Look at the smirk on this guy's face right here as he answers this question.
barbershops to open up ASAP. Most people wanted them open weeks ago.
No kidding.
And candidly, I think their customers may want them open even more than the business owners want them open.
Who's cutting your hair, Gov?
Here's a factor that was looked at that we just need to work our way through. And that is, we do have strategies to avoid having customers come in and aggregate together. The strategy would be to have one customer in per salon worker.
Medical martial law.
But the fact of the matter is, they remain very physically close to each other. I realize they will be wearing masks, but the goal is just to find safe ways in which people can work in close contact with customers while preventing the spread of COVID-19. We think we have some potential solutions. Let us continue to work on it, but we want continued input and best practices and strategies from all of those salons.
But can you understand their frustration?
Absolutely.
Especially when you go into a grocery store and you're in the produce aisle and you're just feet away from someone else who's not wearing a mask?
Great point.
No doubt it's frustrating, which is exactly why today's announcement is not an end of the work. We go to work this afternoon on working on solutions for more businesses to open like hair salons.
Governor, going forward, will anything more be done to increase monitoring of African American communities, which have been disproportionately hit hardest by this?
We are evaluating that, and we are looking forward to working with legislators on trying to formulate strategies that will help us be able to track and monitor and respond to that more effectively.
I couldn't help but notice the Lieutenant Governor mentioned that he suggested people wear masks, not mandate, but suggested it. Today in Harris County, as you know, the largest county in our state, third largest county in the country, the county judge mandated that people in Harris County start wearing masks.
Look at my man in the background shaking his head. He already knows where this is going, because if they were paying attention, there was a big group of us outside of Lena Hidalgo's office, and I think they got the point, but that just wasn't going to happen.
Masks. This happens on the day that you announce big plans to reopen parts of our economy. Some people will hear this and say there's a disconnect, and to that you'd say what, Governor?
Well, first, as we lay out in this booklet, page after page after page, we strongly recommend that everyone wear a mask. However, it's not a mandate, and we make clear that no jurisdiction can impose any type of penalty or fine for anyone not wearing a mask. Everyone should be encouraged, but by my executive order, it supersedes local orders with regard to any type of fine or penalty for anyone not wearing a mask.
Can a business deny you without a mask? They don't mention that here. At least I didn't catch it if they did. Be curious to see how that goes, because the local Costco here said that they weren't going to allow folks in. They were going to follow the Hidalgo edict and not allow people in starting yesterday. I haven't tried to go in, but we'll see.
Governor, you said that we should easily exceed our goal of 25,000 tests per day. Precisely when will that happen, and is that a minimum requirement? Does this plan only work if Texas is testing 25,000 people a day?
I'm going to answer this in part, but ask Dr. Hellerstedt to answer in part also. I will in part tell you what he's told me, and that is, for one, getting up to 25,000 tests is something that should occur early on in the May timetable that we're looking at as we work our way through phase one. The additional tests will be coming in part from the massive increase in the amount of tests being provided by the private sector. Right before coming out here for this, I was on a telephone conference call with the president as well as with Dr. Burks, and they were explaining the increased capacity coming from the private sector to provide those tests. 25,000 is a number that has been provided in part by Dr. Hellerstedt as well as the other doctors on our team, and I will let him explain his analysis there.
Thank you, Governor. Yes, we've looked at the testing capacity around the state, both in the public health system and on the private system, and we believe that we will have available to us 26,000 tests per day. The other encouraging thing is that part of that call that the governor was on, the federal government is committed to solving some of the supply chain problems that have been limiting some of our ability to test, and they're specifically talking about the testing collection kits and the viral transport media that goes with it, and in some cases the personal protective equipment that's required to obtain a good test. So when those scarcities ease, we will naturally be able to ramp up in the amount of testing that we're doing. And again, we believe that we have within our grasp the ability to do 26,000 a day. I'd like to add to that, though, it's not just about the testing. The important thing that the governor talked about today is the fact that we're putting in place and beginning to make more robust every day our contact tracing capability.
There it is. There it is. That, if you take nothing else away from this, laser your focus on that point, contact tracing.
So in other words, when somebody tests positive, there be a system that can be used statewide so that we can reach out to that person who's tested positive, understand where they have been, who they might have exposed, and then in turn reach out to those same people. And that is a powerful tool in containing any outbreaks of COVID-19. So it's not just the testing, it's also the contact tracing
how are they
as
going
well.
to do that?
And
Ask
we're
yourself,
very
how are they going to
happy
do that?
to see that we were able to bring this new system online, the number of new workers that the governor talked about, and again, that information technology, that computerized system, if you will, that will enable us to coordinate and track
5G.
and work with our local partners, our city and county local health departments, in order to have much more robust contact tracing in the future.
Governor, I have seen at least one poll that shows Texans would like to continue shelter-in-place orders. I'm sure you've seen the poll that I'm referring to. Did that weigh into your decision in talking about that?
The goal was to
What
find
idiots would want to
strategies
continue shelter
that
in
would ensure both safety of the public as well as control of the spread of the coronavirus and allowing businesses to open up as much as possible. But understand this. I know there are people who are still concerned about this. There's no requirement that those people leave their home. If you want to stay at home, continue to stay at home.
Amen to that.
If you are involved in a business, there's no requirement that you open that business.
Yeah, you can
have
go into
every
bankruptcy,
right
no
to
problem.
choose your own pathway in life, and you have ultimate control over your own personal.
That he's not lying about. You have the ability to choose your own pathway in life. Absolutely correct. And that's the whole point of this group. We will not comply. So all of these edicts and mandates that they're talking about that are repugnant to the Constitution, or more importantly, to the Word of God, to God's law, are null and void. Period. Full stop.
Safety, and you should use that control. And so if you feel like you don't want to get out and potentially expose yourself, just continue to stay home.
Governor, what's the enforcement of this going to look like in terms of 25%,
Here we go.
50%? Who's going to do it, and are there any penalties attached?
I missed the last part of the question.
Yeah.
No, he didn't. He didn't miss the last part of that question. So anybody that knows anything about interrogation, body language, cells, or any sort of psychology, what you'll notice here is the reporter asked the question about enforcement and penalty. Absolutely, Governor Abbott heard and understood, but he said, I didn't catch the last part. What he's doing there is allowing himself a few more seconds to gather his thoughts and his response. Let's back that up a little bit so you can see what I'm talking about.
If you are involved in a business, there's no requirement that you open that business. You have every right to choose your own pathway in life, and you have ultimate control over your own personal safety, and you should use that control. And so if you feel like you don't want to get out and potentially expose yourself, just continue to stay home.
Governor, what's the enforcement of this going to look like in terms of 25%, 50%? Who's going to do it, and are there any penalties attached?
I missed the last part of the question.
Are there any penalties attached to this? I mean, just basically, who's going to be doing the enforcing here?
Right. Well, so for all of these executive orders, before now and now, there's several levels of enforcement. For one, there's the enforcement of up to a $1,000 fine and 180 days in jail. But the more primary enforcement would be either the local level or the regulatory level. And so for a lot of these businesses, they have an authorization to conduct business in the state of Texas, but of up to a $1,000 fine and 180 days.
Doing the enforcing here.
Right. Well, so for all of these executive orders, before now and now, there's several levels of enforcement. For one, there's the enforcement of up to a $1,000 fine, 180 days in jail. But the more primary enforcement would be either the local level or the regulatory level. And so for a lot of these businesses, they have an authorization to conduct business in the state of Texas. And if they violate the law, which this is now the law, they're subject to losing their license to have an open business.
Thank you.
Catch that? 180 days? Lose your business? This is now the law? What do you think about that? Does that look like we're headed back in the direction of freedom? You tell me. JP Campbell, 7-4, out.